Most couples who are actually starting out on their fertility treatment programs should do some amount of homework themselves. They should understand how these programs work. What are the components of an IVF program, for instance? How do we select patients? What kind of a protocol is offered to our women? Do we give them injections of their choice, or we decide on the injections? What dosages are given and why? What are the do's and don'ts while this process of IVF is going on? How do we collect eggs? Are there any complications associated with this? How do we form embryos? Is it by the process of IVF or by the process of ICSI? Or which is better for you? How do we make these embryos in the lab? Do we culture them all together, or do we culture them separately in different incubators? And when do we freeze them or use them? Do we use it on the second or the third day of fertilization? Or we grow them till blastocysts and then select the right embryo and put it back in your womb? And finally, do we put them back one at a time, or do we cluster them together, put back 2, 3, 4 embryos to your womb just to get you pregnant? Before you get started on your IVF program, please understand the nuances of your IVF program and then get into the program. This will be helpful to you in the long run.